When you're 25, you're at the peak of your stem cells. You're not going to be any better. So you've got to keep everything you've got. And what we put in our bodies and what we're experienced every day affects the ability of those stem cells to do their job. And there's a process called telomerase shortening that occurs as we get older. And the more telomerase we shorten, which is part of the genome, the less we have in our life. So if you can keep that telomerase from shortening, you can keep your cells viable. And that's what I'm talking about. And as your cells become less viable, they become more inflamed. So the matrix that the genome works in, you've got to maximize. And you can do that with good nutrition, is the first step. So if you look at the Krebs cycle, and which is nothing more than a biochemical pathway that helps us make energy molecules so that our mitochondria can do their job. The mitochondria are the powerhouses for our cells. So if you're tired, think about your mitochondria. And just remember that with Alzheimer's disease, inflammation in the brain, your cells are just plump full of mitochondria, not doing a darn thing. So let's go back to the telomerase shortening. We're not having enough energy molecules, right? So what do you have to do for the energy molecules? Be complex. It's simple. Are you getting B vitamins in your diet? Well, look at our nutritional sources. Are you eating McDonald's, which is highly processed refined foods with high fat, high carbohydrate content, or are you eating a nutritious salad with a light vinaigrette and a really good iced tea, or having a piece of fruit? Eating baba ganoush with some a hero. I mean, there's a lot of very good alternatives out there for you to eat. But if you can't, what would you do? The inflammation is mediated through B complex, omega-3s, and vitamin D3. Those three things, if you can do that in your diet every day, will limit the amount of inflammation in your body, whether it's in a joint or in your blood vessels or in your nerves.